Hello, Professor. I'm recording this on my phone, so it might be like a little weird format, just because I'm having technical issues with my computer. Anyway, I'm not gonna lie, this module kind of stumped me a little bit. Of course, like given my job and stuff, I kind of do. In practice, I do these things kind of unconsciously without thinking. But I think the more difficult part was kind of putting it into theory. Um, Anyway, so answering the first question, right, identify and discuss the importance of three vital tools for working through opposition to change. So the three vital tools for working through this opposition to change I got were empathy and relationship building, collaboration and shared decision making, as well as clarity of purpose and transparent communication. So starting off with the first one, empathy and relationship building. The importance of this tool essentially just states that empathy allows for social workers to kind of understand the emotional roots and the emotional trauma and the emotional resistance that might come from a client when they are kind of pushing back and giving a lot of pushback when it comes to resisting change. And that could look like, fear, loss, mistrust. And then the social worker, by utilizing that kind of empathy, the social worker could respond with attuned support and support that matches the client's needs in that particular moment. The impact of this is pretty straightforward, right? When a client feels heard, seen, and validated, they're more likely to engage in the session. They're more likely to respond positively to treatment and recovery outcomes, and they're more in tune with their specific goals as it relates to the change and the helping process. Which is like what we saw through our readings for this week. The second one I got was a collaboration and shared decision making, where essentially the social worker is working with the clients and kind of helping them to collaborate on their own goals so that the client isn't feeling powerless in their own recovery and the client feels as if you know they have a say in their recovery planning, right? So this co-creating of goals and strategies increases this motivation and accountability with the client and the social worker, which leads to more sustainable change. That's kind of the impact of that. And the last one is clarity of purpose and transparent communication. So for the importance for this one is ambiguity breeds mistrust. So clear, constant messages about the whys behind why the social worker is doing stuff may help with that kind of pushback when it comes to treatment. And transparency reduces anxiety and aligns expectations, especially in system level interventions. And the next question, in your opinion, to what extent are you able to recognize and assess behavior in the context of a helping relationship? So with this one, I feel as if I have developed a strong capacity for this to recognize and assess behaviors within, the helping relationship and the helping process. Right by, like I said, with my specific job as a QMHP, qualified mental health professional, by observing the verbal and nonverbal cues. So what is the client saying directly, any body language, or kind of like any psychosomatic cues, right? So like when clients start becoming disengaged with the session, they're not actively participating, things like that. Contextualizing behaviors within systemic, cultural, and trauma-informed care frameworks, and also by identifying patterns and stressors, kind of like an eco map, right? So patterns and stressors, client support systems, and things like that. So in practice, I feel I have a good kind of strong capacity to recognize these things. For this specific week, it was just kind of putting it into theory that I was having trouble with, and kind of like because I do it I do it unconsciously. So then when I had to actually sit down and think like, what would I say, what would I do, that kind of stumped me a little bit. Otherwise, I think I can kind of recognize that pretty well. In your opinion, to what extent are you able to appropriately use yourself to counter opposition to change in the context of a helping relationship? Again, I do believe that I can appropriately use myself or use the self to counter opposition by kind of balancing warmth and empathy with the use of boundaries, practicing that additive empathy that we learned throughout this module, and as well as modeling vulnerability and transparency. This, in a way, I do the best. I think, given my recent, or like my recent positions, working here at Integral Care and working at inpatient substance use, I think this is the best way, or I don't want to say my strongest suit, but my strongest suit, just because I feel as if I use myself, like I use the self, to accurately and appropriately relate to the clients so that they feel seen and they feel heard, while also maintaining that therapeutic relationship by utilizing strong boundaries. And this gets, for me, the use of the self to counter that opposition is kind of my strongest suit when it comes to working with my clients. So I do believe that one's kind of like up there on my things that I do well. What additional training and support will you need to appropriately assess behavior and to apply the use of self when working with individuals actively displaying problematic behaviors? So for this one, to kind of deepen my capacity, I'm also a certified community health worker. And so if I feel I'm not getting a lot of kind of assistance or kind of consultation from my current position with my supervisor, I also kind of review HHSC guidelines for the state of Texas, and I look through continuing educations, and a lot of them through the various websites that that the HHSC provides has a lot of training on motivational interviewing, working with or dealing with difficult clients and stuff like that. So I utilize those trainings to create a foundational support if I need extra assistance. Of course, throughout this session or throughout this course, I continuously state, ongoing consultation and reflective by my supervisor. My supervisor provides great support for me as well. But like I said, if I do need like that extra support and it's something that she's not able to provide me, then I do seek out additional trainings, like through continuing educations. The job, Integral Care does promote like workshops that you can attend, both inside and outside of the company. So I utilize those as well, and I feel that kind of some of training and support really helps when I, like I said, I need to kind of deepen my understanding and my capacity for this. Awesome, thank you for watching my video.